Chevy Chase.
Welcome back. It's now time for Talk of the Town. And today it's about a sleep disorder that affects millions of people, and some of them don't even know they have it. Sleep apnea can rob you of a restful sleep, and it can even affect relationships with those around you. Today we're talking with Dr. David Alexander of the Lexington Clinic about the warning signs, the risk, and some new treatments that can help. Doctor, welcome to the show.
Yeah, thank you for having me.
Hello. So we hear about sleep apnea, but people may not be familiar with exactly what it is. So give us the diagnosis.
Yeah, so sleep apnea is basically when you stop breathing at night when you're sleeping. The most common form is obstructive sleep apnea, which is where the soft tissue of your throat, when you fall asleep, falls back and obstructs your airway while you're trying to take a breath in at night.
Okay. Yeah. So you get the snorting.
Yes. So snoring is a very common sign of it, and then gasping for air. Patients who kind of wake themselves up from sleep feeling like they're smothering is a very common sign. Yeah. We often find out about these patients through bed partners who, kind of recognize that something's not right.
Yeah, that's what I was just thinking, because that's how my ex-husband knew he had it, was because I heard him not breathing in the middle of the night.
Yes.
And so what do you do in the event you think you have sleep apnea?
Sure. So first step we usually do is a sleep study on patients to basically confirm that they do have sleep apnea, and that also helps us confirm there are different types of sleep apnea and then how severe it is. And really the treatment options we tailor based off of those findings on the sleep study.
Okay, and a common treatment is a CPAP machine.
Correct.
Which helps with that. But a lot of people are kind of, they don't want to do a CPAP. They think it's uncomfortable or whatever. But talk to us about the different types of CPAPs.
Sure. So CPAP is what we consider the gold standard of treatment for sleep apnea. So if you do have clinically significant sleep apnea, that's usually what we're going to start you with. There are a lot of patients who really struggle with wearing the mask at night for whatever reason. In those particular patients, we look at other options. Those can range from dental appliances, which can be effective for more mild sleep apnea, all the way up to surgical interventions, which is what I specialize in for sleep apnea.
Oh,
yeah,
okay.
and you brought, it's called the Inspire with us today?
Yes, correct.
Let's talk a little bit about this.
So this is what we call the Inspire hypoglossal nerve stimulator implant. It looks very much like a pacemaker. We implant it over the right chest typically, and what it does is when you're trying to sleep at night, it stimulates your tongue, and it actually pushes your tongue forward a little bit to open up your airway.
Oh, wow.
So it's probably the newest thing on the market for sleep apnea. The Inspire device in particular was FDA approved in 2014, so it actually has been out for about 12 years now, and has a very proven track record of both working well for patients and safety profile as well.
Okay, so there's no mask, there's no anything else, you just have that implanted, and then you have that other little transmitter device.
Yes, so typically when we put these in, you put the implant in the right chest, and then there is also a wire. This one is just a demo. It was cut a little short. But there's a wire that runs up into your neck. All done under the skin, so there's nothing visible externally. And it's an outpatient procedure. Usually takes about an hour and a half or so to place one of these. And once you put it in, it is an effective alternative for patients with certain types of sleep apnea that really are struggling with the CPAP.
So when people, whether they're using the CPAP or the Inspire, what are some of the benefits they see once they receive some help?
Yeah, so some of the more common symptoms of sleep apnea, just feeling tired and fatigued all the time. You think of folks that fall asleep at red lights, will sit down to read a book and they're immediately falling asleep. And so the biggest benefit is just more energy and feeling more like yourself, and actually feeling when you get up in the morning like you got a good restful night of sleep the night before. There are also a lot of other medical comorbidities associated with untreated sleep apnea, everything from heart disease, stroke, dementia, you name it, it's probably associated with untreated sleep apnea. And so whether it be with CPAP or surgical interventions such as an Inspire implant, one of the goals with that is that we help reduce those risks for you long term. In terms of helping get your blood pressure back under better control, reduce your risk of heart attack, stroke, dementia, all of those things long term if you were not to have treated it.
And just better quality of life, and it will improve your marital relationship because your spouse won't want to smother you with a pillow because of all the noise you're making.
Yes. No, that is absolutely one of the big things we see too.
Which is really the last resort for a good night's sleep is the smothering.
It is. It's the last resort. People just need to come and make an appointment and see you at the Lexington Clinic. You'll get them all evaluated and set up to get a restful night of sleep, because it is so important. Well, doctor, thank you for being here today.
Absolutely. Thank you for having
and
me.
sharing this important information. And we have all of the information for the Lexington Clinic Ear, Nose, and Throat up on your screen.